আসসালামু আলাইকুম। সুপ্রিয় চিকিৎসকবৃন্দ এবং মেডিকেল শিক্ষার্থীবৃন্দ, আশা করি আপনারা সকলেই ভালো আছেন। আজকে আপনাদের মাঝখানে আমরা অসাধারণ একটি সেশন নিয়ে হাজির হয়েছি। প্রতিষ্ঠা লগ্ন থেকে জেনেসিস অনলাইন ইউনিভার্সিটি সবসময় আপনাদেরকে অসাধারণ বাংলাদেশের প্রথিতযশা শিক্ষকদের অসাধারণ সমস্ত লেকচার আপনাদেরকে উপহার দিয়ে যাচ্ছে। তারই ধারাবাহিকতায় আজকের প্রফেসরস আওয়ারে আজকে আমাদের সাথে যুক্ত আছেন সহকারী অধ্যাপক ডক্টর রশিদুল হক স্যার। স্যার সহকারী অধ্যাপক হিসেবে কর্মরত আছেন স্যার সলিমুল্লাহ মেডিকেল কলেজ এবং মিটফোর্ড হসপিটালে। এবং আজকের টপিকটি হচ্ছে আমাদের ইন্ট্রোডাকশন টু সাইকিয়াট্রি ফর আন্ডারগ্রাজুয়েট। তো আজকের সেশনে আমরা কথা বলবো সাইকিয়াট্রির বেসিক কনসেপ্ট নিয়ে এবং ইন্ট্রোডাকশন নিয়ে। তো চলুন তাহলে আমরা দেরি না করে আমাদের স্যারের অসাধারণ সেশনটি শুরু করে দিই। আপনাদের যদি কোনো প্রশ্ন থেকে থাকে আজকের সেশনটি সম্বন্ধে আমাদেরকে কমেন্টস করে জানাতে পারেন এবং আমাদের গ্রুপে আপনারা জানাতে পারেন। আশা করি আমাদের সঙ্গে থাকবেন। আপনাদের সকলকে অসংখ্য ধন্যবাদ। স্যার আপনি শুরু করতে পারেন প্লিজ।
ধন্যবাদ তারেক। আমার প্রাণপ্রিয় ছাত্রছাত্রীবৃন্দ, welcome you all to today's lecture on the introduction to psychiatry for the undergraduates. Today I want to discuss about the introductory psychiatric basic knowledge that is very important for the undergraduate students. For this reason, I designed this lecture for very easier way how to understand the psychiatry from the beginner who just entry into the psychiatry department or first class of the psychiatry department in your undergraduate level. So I think this lecture is very fruitful for you, and let us start our lectures. So this is the first class one, Introduction to Psychiatry. I'm Dr. Mohammad Rashidul Haque, Assistant Professor, Department of Psychiatry, Mitford College and Mitford Hospital. Just like this baby, just a newborn baby, the boy or girl, the newborn baby do not know anything about the world. Just like this, you start the psychiatry as a newborn baby, and you know nothing about the psychiatry. Just like think like that. So this picture is given here to think yourself as a newborn baby, and you just learn the psychiatry as a beginner. So today's my lecture is has these objectives. We completed these objectives in these lectures. First of all, we know what is psychiatry, what are the branches of psychiatry, history of psychiatry, neurosis, psychosis. These are the old term, but this is important clinically till now. And very important things that is very unique in psychiatry, that is the mental state examination. That is unique in psychiatry. No department of the medical science, they will give you the knowledge about the mental state examination. So you have to learn this mental state examination in psychiatry department. So first of all, we must know what is psychiatry, how the term come in medical society and medical science. So psychiatry, this term first time coined in 1808 by the professor Sir Christian Rell. And in his nominal paper, he first used the term in 18th century. Before that, no term of psychiatry is used. So psychiatry came from the two Greek words. The first Greek word is psych, which means the soul or mind. And the second word is iatry. So psychiatry, if you divide the term psychiatry in two terms, psych and iatry. Psych, that means soul, and iatry means medical. That is the to heal or medical treatment of the disease of the soul. So psychiatry literally means the medical treatment of the disease of the soul or mind. So we have many diseases in our soul, as we have the many diseases in our body also. Like this, our soul suffer from different type of mental illness, different type of psychiatric illness. So we treat this psychiatric illness. So the department or the branch of medical science which deals with this disease of the mind is called the psychiatry. So psychiatry, it is a branch of medical science which deals with the study, diagnosis, treatment, and prevention of mental illness of human. So it is related with the human, not the animal. You also know the another term, that is the psychology. Psychology is a branch of science, not the medical science. that is studying the different universities, like at Haque University or Jahangirnagar University or Rashidul University, they have the branch of psychology. So in psychology, they are studied the mental processes and behavior of the human and animal. So they are different. They study the different type of study they are done on the animal also. But psychiatry, this is only for the mental illness of the human. This is the branch of medical science, not the branch of science. It is a branch of medical science. So in psychiatry, we must know what is mental health. Mental health, it is a state of well-being. It is a state of well-being which realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and fruitfully, and to able to make a contribution to his or her community. This is the long definition, but in a short way, we must know what is mental health. This is a state of well-being. A person can adjust with the surroundings, daily stresses of life. He can able to do his daily works fruitfully and contribute to the society. This is called mental health. So we have different branches in psychiatry. These are the common branches. Though different medical college in Bangladesh, we have no branches of psychiatry. Only in the National Institute of Mental Health, they have the 5 branches of psychiatry. The most common branches are child and adolescent psychiatry, adult psychiatry, geriatric psychiatry, forensic psychiatry, social and community psychiatry, addiction psychiatry, and psychotherapy. And we have other different types of psychiatry branches, like consultation and liaison psychiatry, organic psychiatry, neuro psychiatry, cross-cultural or transcultural psychiatry, emergency psychiatry, and disaster psychiatry. These are the different branches of psychiatry. In a large way, if we want to give the services to the people of different type of mental illness, we should establish these different branches of psychiatry to deal and research in different type of mental illness. So the history of psychiatry is very ancient, very old. So the textbook or Ayurvedic texts and Samhita, these are the old texts in the Indian psychiatry. In these books, we see the different type of mental illness are they depicted there. The different type of mental illness related history we found there. But before KS 400 BC, and Hippocrates first time theorized that the physiological abnormality may be the root of the mental illness. So before KS 400 BC, Hippocrates first time think that mental illness not due to the demonic possession or any possession of unnatural things to a person that may produce the psychiatric illness. This is scientific thinking that was thought by the Hippocrates before KS 400 BC, and he thinks that physiological abnormality may be the root of the mental illness. After that, in 400 to 500 BC, in Greece, Hippocrates wrote in his book that he went to the home of the Democritus and found that Democritus cutting the animal body. And he asked him, why you are cutting the animal body? And Democritus answered, he was attempting to discover the cause of the madness and melancholy. This madness and melancholy, these are the mental illness, and he want to find the cause of the illness. And for this reason, he cut the animal body and want to find the cause of the mental illness. And for this, Hippocrates praised his work, because during this time, most of the disease think that these diseases are caused by some unnatural power or unnatural effect of the towards the human. So in the first time, in 705, the first psychology of the medieval, especially asylum, that was established in the Baghdad, Iraq. And at that time, many renowned physicians like Al-Razi, Ibn Sina, Najabuddin Muhammad, they was write different type of mental illness and treat the mental disorder in that time. And they are very famous in the European country also. In the 13th century, to treat the mental illness, In Britain, Bethlehem Royal Hospital, they first time established in London, and later in the France, Paris, Bessiter Hospital and Salpeter Hospital was established. And in 1808, Country Asylum Act was passed, and in the Britain, and under this act, they established different type of mental asylum. Until then, no drug was found, was discovered, and no drug for discovered for the treatment of the mental illness. Only confinement and different type of inhuman treatment was given to the patient. And later we see what type of inhuman treatment was given to the patients. And 1800s, psychiatry got the branch of medical specialty in early 1800s. And Dr. Philippe Pinel at the Bessiter and Salpeter Hospital in Paris, he was first time removing the chain from the patient who had the violent psychotic patient. He removed the chain from the patient and wanted to treat the innocent woman, and that was the first time. And this called moral therapy. And he, at that time, he thought that the human has, those are suffering from mental illness, if they treat with the moral therapy, the patient can be recovered. And he was the father of modern psychiatry. So inhuman treatment in the psychiatry in the old days, these are the different type of inhuman treatment that has no scientific basis for the different for the effect in the mental ill patients, like definitions. That means they do a bore in the brain and they try to find out the cause of the illness, and this is a very inhuman, and many patients was died at that time. Bloodletting and purging also a very inhuman treatment for the mental ill patients. Isolation in a island or any asylum. This is for the long time, year to years, the patient may be isolated from the society. And insulin shock therapy. Sometimes the patient was given insulin and become shocked and recover the patient. If they think that if insulin shock therapy is effective in psychiatric disorder, but many patients was died at that time in insulin shock therapy, and it was not. It was proved that it is not effective in human in psychiatric disorder. So incinerations, they think that those people who are suffering from psychiatric illness, they have many jinn, bhoot, or different type of demonic possessions that was possessed on the patient body. So the patient body should be incinerated. So this is a very inhuman treatment in the ancient age. And spinning chair therapy, immersion in cold water, electric shock. Electric shock, that is very this is scientific nowadays, but at the ancient time, this electric shock was given in an unsafe way. So many patients was died after this electric shock. But nowadays, electric shock, this is called electroconvulsive therapy, was given in under general anesthesia. The risk is minimum, no risk, and the risks are due to the general anesthesia, not due to the electric shock, because very few amount of electricity was passed for few seconds, and this is very effective in some indicated patient. So this term neurosis and psychosis is very important for undergraduate student. In their final prof, they have to face different type of questions in viva and exam, written exam, and they have to know what is neurosis, what is psychosis, what are the criteria of neurosis and psychosis, what are the example of neurosis and psychosis. In a broad term, this is very important in clinical setting also, in word when you see the patients. But nowadays, this term are obsoleted in the recent books, because neurosis and psychosis, this was first used by the Sigmund Freud in 1886. And in neurosis, what is neurosis? Neurosis is a minor type of mental illness in which the patient has touch with the reality. The patient has the touch with the reality of what was happening around him or her, and he can know what is neurosis. In neurotic patient, the patient can understand his everything, and he can give the answer, give the history, and take the drugs from the physicians. So in neurotic patient, they have the insight to illness. They can understand everything, and they can mix with, they can take the drugs himself or herself in neurotic patient. And so what are the criteria of neurosis? We have to know. It is the exacerbation of the normal, emotional, psychological, and physiological phenomenon. That means a person have normal anxiety, but when the anxiety is exaggerated, it is called anxiety disorder. It is a neurosis. A person may have the sadness or a transient level of depression, but when it is persisted for a long time, it is it has impact on the personal functional impairment. So it is then we call it a depressive disorder. So it is a neurosis. So personality of the patient is not grossly impaired. The insight to illness, that means the patient insight to illness is intact or present. That means patient can understand what the physician says, patient can understand what he has the problem, and patient can understand what he wants to recover from the illness. So in a neurotic patient, the patient can understand everything. So in neurosis, we have different type of example like generalized anxiety disorder, panic disorder, conversion disorder, phobic anxiety disorder, somatoform disorder, acute stress disorder, post-traumatic stress disorder, sleep disorder, eating disorder. These are the different type of neurotic disorder. And what is psychosis? Psychosis is a major type of mental illness in which the patient has no touch with the reality. In the most of the time, patient could not understand what he was suffering or he has the problem. The patient think that he has no illness. He state to the physicians and other family members that he is completely okay. He has no illness. So he did not need to take any drug. So in the psychotic patient insight is lost or insight is impaired. So in psychotic patients, this criteria of psychosis is the patient should have delusion, hallucination, irrelevant speech, disorganized or catatonic behavior. We will discuss more about the different terms that was come first time in front of you, like delusion, hallucination, or what is catatonia. We'll discuss later in the lecture. The personality of the patient is grossly impaired. And a psychotic patient is very violent, sometimes very violent, aggressive, maybe disorganizedly behave, maybe doing some nuisance or unacceptable behavior in front of others or in the society. So the personality of the patient is grossly impaired at that time. So insight to illness is absent or impaired also. The example of psychosis is schizophrenia, mood disorder. In mood disorder, we have mania and hypomania, and substance-induced psychosis, organic psychosis, postpartum psychosis, medications like different type of medication may induce the psychosis. A Parkinson's disease patient who take the levodopa for a long time may produce the psychotic illness or psychosis. A patient who are taking the steroid for a long time for SLE or any type of connective tissue disease, they may develop the steroid-induced psychosis. So these are the different examples of psychosis. In Bangladesh, we have some data about the our mental disorder. In 2005, NIMH, National Institute of Mental Health, and WHO, they collaboratively done a study survey, and they found that 16.1% people are suffering from mental illness above the age of 18 years. And among these, the psychotic patient, only 1.1%. Just we give you the criteria and example of psychosis and neurosis. So psychotic patient is very few, 1.1%, and neurosis patient is majority of the patient are suffering from neurosis. So here we given two data also. That is the major depressive disorder 4.6% and anxiety disorder 8.6%. So majority of the patient was suffering from anxiety disorder, different type of anxiety disorder, and major depressive disorder. And 2018, we have another study that was conducted by the NIMS, National Institute of Mental Health, DGHS, Non-Communicable Disease Control, and WHO. They collaboratively done this study, and they found that above the age of 18 years, 17% are suffering from mental illness. Among them, psychotic patient are only 1%, and major depressive disorder 6.7%, and anxiety disorder 4.5%. They have also done some epidemiological data. In the rural area, 16.2% are suffering from mental illness, and in the urban area, 18.7% are suffering from mental illness. So it is very important in psychiatry, we should learn what is mental state examination. In our medicine placement or medicine surgery or gynae or neurology or any type of placement in your ward placement, you learn the different type of examinations. They have the special examination in different department, but in psychiatry, you must learn the mental state examination. It is unique in psychiatry. So what is mental state examination? Mental state examination is a systematic and scientific way of observing and interviewing the patient during consultations. So during consultations, when we observe and interview the patient in a systematic and scientific way, then it is called a mental state examination. So what are the importance of mental state examination? Through mental state examination, we can explore the psychopathology. What is psychopathology? Psychopathology means disease of the mind or soul. This is called psychopathology. So we explore the psychopathology of the mental disorder, and we can differentiate organic mental disorder from functional mental disorder. So some disease that was occurred due to some organic disease, like a person who is suffering from dementia may develop some psychiatric illness. A person who have Wilson disease may develop some psychiatric illness. A person who have electrolyte imbalance or SLE or any type of disease, many type of neurological disease, they commonly present with the psychiatric sign symptom. So this is called organic mental illness, and sometimes we could not find the cause of the illness. Only the psychiatric sign symptom present to us. And in investigation, all the investigation findings are normal. So it is called functional mental disorder. So we can differentiate the organic mental disorder from the functional mental disorder, and we can forecast the prognosis of the mental illness. So mental state examination is a systematic and scientific way of examining the patient and observing the patient. So we have 7 points in mental state examination, and this is very systematic and scientific. And first of all, appearance and behavior, speech, mood and affect, thought, abnormal perception, cognitive function, and insight to illness. You must learn this in a systematic way. And we examine the patient or observing the patient during consultation in this systematic way. First of all, appearance and behavior. When the patient enters the doctor's room or when the patient sitting in the waiting room, we start the mental state examination through the CC camera, or when the patient enters in the psychiatrist room, we start the mental state examination, and we observe the body build of the patients, whether it is obese, below average body build, cachectic, or average body build. And the patient facial expression, we can observe the facial expression and eye-to-eye contact, dressing and grooming, involuntary movement, social behavior of the patients in the doctor's room, and rapport, how the rapport is established with the physicians. And then the second point is mood and affect. So what is mood and what is affect? Mood is a subjective, persistent and pervasive emotional state of a person that colors the person's perception of the light. This is the definition. Actually, it is the emotional state of a person that is persistent and pervasive. Pervasive means that is present in everywhere, and not in your mood is fluctuating at home and outside your home. That is not called pervasive. Pervasive means all the time and all the places the mood will be the same for the patients. And this is the mood is called emotional state, persistent, pervasive emotional state of a person. And it is a subjective phenomenon. We ask the patient, how you feel today? How is your spirit today? This type of question we ask the patient, and the answer is given by the patient. And this is called mood. This is subjective. The patient answer is subjective, and this is the mood which is persisted for at least a few days. In depressive mood, the depressive mood should be persisted more than 2 weeks. Then it is called depressive disorder. So different type of mood we see in the patients. So elated mood, that was found in the mania and hypomanic patient. Irritable mood, this is most common in the different disease like anxiety disorder or any type of neurotic disorder. The patient may develop the irritability. And the depressed mood, that is commonly found in the depressive disorder. Expansive mood, that is also found in the mania and hypomania. Labile mood, that means the mood is fluctuating from elated to sometimes the patient may very elated and euphoric, and suddenly change the mood to a crying spell. So this is called labile mood that may found in different type of disease like mood disorder or frontal lobe syndrome or other neurological disease. And what is affect? Affect is the objective phenomenon. What the examiner see in the patient, what the psychiatrist or examiner see in the patient, that is called affect. That is the state of the person that we see that what the patient facial expression, speech, body movement, posture, and gesture. Through this, we can assess what the affect the patient has. There are different type of affect. Like the affect may be normal within the normal list. The affect may be restricted. Affect may be constricted, blunt affect. If a patient is suffering from depression, severe depression, the affect may be blunt or flat, and sometimes incongruous affect. Sometimes the patient is crying after hearing a good news. This is called incongruous affect. The patient is smiling after hearing the death of father news. So it is an incongruous affect. So affect is the objective emotional state that was observed by the physicians or those who done the mental state examination. And then the third point is your speech. In speech we see the rate of the speech, rhythm of the speech, and volume of the speech. Whether the patient speech rate, rhythm, and volume is increase or decrease, or the speech is relevant or irrelevant. Sometimes through the speech is the mirror of thought. We know that speech is the mirror of thought. Through the speech, we can assess the different type of mental illness. And then we see the thought process of the patient. So during the assessment of the thought, we see the form of the thought and content of the thought. In form of the thought, like a sentence, I eat rice. So this is a sentence, it has a grammar, it has a structure. Like this, our thought has some structure, some grammar. But sometimes this grammar or structure is breakdown, and then it is called the formal thought disorder, like perseveration, circumstantiality, over conclusion, tangentiality, flight of idea, night derailment. I will explain it later in the next class. And neologism, possession of thought, like thought insertion, thought withdrawal, thought broadcasting, thought blocking, verbiage errations, thought salad. These are the different type of formal thought disorder. I just give you one example of formal thought disorder, like perseveration in frontal lobe syndrome. When the patient got trauma in the frontal lobe or there is a tumor in the frontal lobe, the person may develop repetition of the same thought. The answer of the first question is appropriate, but the later the question patient answered the same answer, but the question is different. Like I give you an example. What's your name? My name is Iqbal. What's your father name? My name is Iqbal. Where do you live in? My name is Iqbal. So the patient answer is the same, but the question is the different. So the thought is fixed in the same answer. So this is called perseveration. This is a formal thought disorder. Sometimes there are lots of different example of the different formal thought disorder. Later we will explain this, all the formal thought disorders. And the content of the thought. So in the content of the thought, we should see that delusion, overvalued idea, obsessive thought, suicidal thought, homicidal thought, phobic thought, any preoccupied idea. In delusion, we in undergraduate level, we must know what is delusion and what are the different type of delusions. And we should know about the obsessive thought also, because OCD, obsessive compulsive disorder, is a neurotic disorder, and obsessive, what is obsession and what is compulsion, we should know about the obsessive thought also. So we must know what is delusion. Delusion is a belief. This is not a false belief. It is a belief which is fixed, firm, and unshakable, and which is based on inadequate ground, and which cannot be removed by giving evidence to the contrary, and which is not correspond to the patient educational, cultural, and religious background. So if a person cultural and religiously believe that his disease will recover after taking the some traditional treatment, this is not delusion. A person who have a goiter and repeatedly taking the traditional treatment for 1 or 2 years, this is a religious or cultural beliefs of the patient. This is not a delusion. But when a child think that his mother giving poison to in the food, he believes this type of he developed this type of beliefs. But after giving all the evidence and to the patient, he could not shift it from his beliefs. This is unshakable, fixed and firm. Then it is called delusions. So there are different type of delusions like persecutory delusion, delusion of reference, delusion of grandiosity, delusion of hypochondriasis, delusion of poverty, nihilistic delusion, desire delusion, erotomanic delusion, and delusion of control. These are the different type of delusions, and these delusions can be. You should know the different type of delusions and what are the delusion of persecution. That means a person believes that someone want to do harm or to his reputations, or try to kill him, or try to spy against him, but there is no reality about this thought or about this belief. This is called persecutory delusion. And delusion reference that a person when thinks that believes that other people are following him, they are gossiping against him, but there is no reality about this type of beliefs. This is called delusion of reference. And delusion of grandiosity, a person thinks himself or herself that he has the superpower, he has the ability to do anything. So this type of beliefs, though he has not such type of capability, so this is called delusion of grandiosity. These delusions are developed in different psychiatric disorder, schizophrenia, manic disorder, mood disorder, other type of psychosis. This type of delusion was developed. An abnormal perception, before going to this abnormal perception, we should know what is perception. Perception is a normal, যেটাকে আমরা বাংলায় বলি যে অনুধাবন করা। মানুষের মধ্যে তার স্পেশাল সেন্স অর্গান, we have 5 special sense organ, and we have the normal perception, like our touch perception, sensory perception, visual perception, auditory perception, our gustatory perception, or olfactory perception. These are the different type of perception we have. But when it is become abnormal, then it is a disease, psychiatric disorder. In different type of psychiatric disorder, the normal perception will be distorted and the patient may perceive abnormally. This is called abnormal perception, like hallucination, illusion, depersonalization, derealization, Capgras syndrome, Figoli syndrome, deja vu syndrome, and James-Boo syndrome. We just in undergraduate level, we must know what is hallucination and what is illusion. So hallucination is a percept. It is a percept without an stimulus. There is no stimulus, but patient can perceive, and two corresponding sense organ, like a person can hear some voices without any stimulus. Other people do not hear, but the patient can hear the voice of other people's. So it is a auditory hallucination. Patient can see different type of pictures or film scene or any color or any objects, but other people did not. So this is visual hallucination. A person can take the taste of any bitter taste or very sweet taste in the tongue, but actually there is no sweet or any bitter objects in the tongue. So it is a gustatory hallucination. These are the different type of hallucination, and we know that third-person auditory hallucination are mostly found in schizophrenic patient. So we have 5 type of hallucination, like auditory hallucination, visual hallucination, olfactory hallucination, gustatory hallucination, somatic or tactile hallucination. In formication, like who take the cocaine for a long time, they develop this tactile hallucination. Like the patient complained that when a person taking the cocaine for a long time, the patient complained that insects are crawling under the skin, but actually there is no insect. So it is a tactile hallucination. Patient complained that he or she may get the smell, bad smell or sweet smell, but actually there is no smell around him or her. Other people did not get the smell. So it is olfactory hallucination. So in third-person auditory hallucination, that means 2 or more voices come in the in his ear. He can hear the three or more voices, this is called third person auditory hallucination that is found in schizophrenia. And second person auditory hallucination when the one or two person speaking with the patient like you or as a second person, then it is a second person auditory hallucination that is found in mood disorder. And other hallucination mostly found in organic mental illness. So we must learn hallucination and the illusion. What is illusion? Illusion is a misperception or misinterpretation of external stimulus. Here the stimulus is present and the person misinterprets the stimulus. This is called illusions. But in hallucination, we see that there is no stimulus, but the person can perceive the stimulus. So this is called hallucination. And in the illusion, there is a stimulus, external stimulus, and the patient misperceive or misinterpret the external stimulus. So there are different type of illusion, like seeing a snake, to its rope, or macropsia or mirage. We all know about the mirage. Macropsia means seeing a small object to a large thing, or a large object can see a very small things. This is called micropsia. This is the illusions. These are pictures of illusions. So thank you all for today for listen the lectures. And I think if you have any questions, you can ask me in the chatting box, and I will try to answer the questions. And today's lecture is mainly on the introductory, what is psychiatry, history of psychiatry, and what is neurosis, psychosis, branches of psychiatry, and the mental state examinations. These are very important in the undergraduate level. And later we will discuss elaborately about the mental state, different points of the mental state examinations, and different psychiatric disorder that is very important in the undergraduate level. So thank you all today.
স্যারকে অসংখ্য ধন্যবাদ এত সুন্দর একটি সেশন আমাদের মাঝখানে উপহার দেওয়ার জন্য। অনেকটা মুগ্ধ হয়ে স্যারের লেকচারটা আমরা শুনছিলাম। তো আপনাদের যদি কোনো প্রশ্ন থেকে থাকে সেটি আমাদেরকে কমেন্টস করে জানাতে পারেন। আমরা চেষ্টা করব আমাদের পরবর্তী ক্লাসে সেই বিষয়গুলো ফোকাস করে আমাদের পরবর্তী বিষয় নির্ধারণ করার জন্য, এবং আমাদের আলোচনাকে পরবর্তী সেশনে কন্টিনিউ করার জন্য। স্যারকে অসংখ্য ধন্যবাদ স্যার, এত সুন্দর একটি সেশন আমাদের উপহার দেওয়ার জন্য। থ্যাংক ইউ।
ধন্যবাদ সবাইকে।